Fertility awareness method or natural family planning can be used for two different reasons. It can be used to prevent pregnancy, and it can also be used to achieve pregnancy. I will caution you, if you are breastfeeding and you want to use this to prevent pregnancy, it is very difficult because your signs of fertility will be changed by the hormones that are produced by breastfeeding. Okay, so one of the easiest ways to think of fertility awareness is in the calendar method. I'm sure a lot of you have heard of that. And in a nutshell, if you have a period that comes every 28 to 30 days, usually you ovulate around day 14, 15. Now, for a woman, when you ovulate is when you can get pregnant. Men, they can help a woman achieve pregnancy any day, but we can only get pregnant when we are ovulating, and usually that happens one time a month. Now, if you do not have a regular period, there can be other ways that you can other changes in your body that you can pay attention to that will help you understand if you are ovulating or not. The first thing I would recommend that you do is start tracking your period. Okay? You need to get either a piece of paper or an app on your phone that you can write down when you get your period, the first day and the last day. Okay? Now, interesting thing is, the first day of your period is the first day of your cycle. Let's say you get your period on the 1st. Guess what? Day 14, 15, if you have a 28-day cycle, is when you are going to potentially ovulate. Now, so let's say you bleed until the 5th. Technically, your safe days to have sex are days 6, 7, 8, 9. I'm going to caution you this entire week to about the 17th or the 18th are a big time when you can get pregnant, because sperm live in the female's body for up to 72 hours. That means if you have sex on the 10th and you ovulate on the 13th, you could have some live sperm in there. Okay? Same if you ovulate on the 14th. It takes about 24 hours for the egg to travel down the fallopian tube to the uterus. When you ovulate, the egg goes into the fallopian tube, and actually in the fallopian tube is where you can get pregnant, not in the uterus. The baby grows in the uterus, but you get pregnant in the fallopian tube. Sperm enter through the vagina, and then they're meandering around, confused and lost, but hoping to land in the fallopian tube. And they can be in there for at least 72 hours alive and ready to meet an egg. And so if those two windows of opportunity meet, you can get pregnant, and then the egg continues to move down and grow in the uterus. Generally, for most people, after they pass day 17, 18, they have roughly 8 days before their period starts that they can have sex without concern of getting pregnant. Now, what are the other signs that you might see that you are ovulating? Here is a picture of your uterus. This is actually your vagina, and then the outside here would be, this section down here, all right, the vulva. And then, of course, your ovaries and your fallopian tubes. All right, so the cervix produces mucus. Just like your nose produces mucus, and mucus has lots of different roles, and one of the roles is that it helps protect things from going into your lungs. Okay, so we're gonna go back up here. Cervical mucus, actually there's types of cervical mucus that prevent sperm from entering into the uterus. But around the time that you ovulate, there's a type of mucus that happens that's stretchy, and it produces rods. And it says, come on in, sperm, let's go make a baby. And that type of mucus you can actually notice after you use the bathroom. When you wipe, you can feel that there's something extremely slippery. and that is fertile cervical mucus. Let's talk about how you check cervical mucus. First of all, anyone who is going to be having a baby and anybody who is having sex, anybody who's preventing pregnancy, you need to be familiar with your body. Your body is your body, and all the things that it does are the things that you get to know about and that are special and what make you you. Okay, so obviously everybody goes to the bathroom, everybody pees, everybody poops, and everybody wipes, okay? So if you want to use fertility awareness, one of the most important things that you can do is get into a habit of wiping before you pee or poop. Fold the toilet paper so it's flat and wipe from front to back. Pay attention. Is this slippery? Is it sticky? Is it dry? Okay? Slippery, sticky, dry. And always remember, if it's slippery, it's fertile. If it's sticky or if it's dry, chances are it's not. Okay? So, then you also need to wipe, of course, after you pee or poop. And I want you to pay attention. Especially, sounds gross, but after your poop. Because often there's fertile cervical mucus in your vaginal vault that get pushed out when you poop. And so when you wipe, you're gonna notice, wow, that was really slippery on the front end, and then of course, the back end, okay? Now, the even grosser part, look. If you feel it slippery, take a look at that paper. You wanna see if there's a big glob of clear mucus like you just blew your nose. And if it's there, if you wanna get pregnant, it's a good time. If you do not wanna get pregnant, no sex. Okay, then you also wanna mark that down on your calendar so that you understand a rhythm of when you're ovulating. And you also want to pay attention that you do not have sex for at least 4 or 5 days, because how long sperm can live in the woman's body and how long it can take for that egg to reach the uterus. Here's an example of a calendar method. It is showing the first few days, which is your period. So day 1 of your cycle, even though this is day 4 of the month, the day 1 of your cycle starts with the first day of your period. Now, during this time, generally we do not recommend that you have sex or unprotected sex, and the main reason is because you cannot tell if you have any fertile signs when you are bleeding. Now, these 2 days here, fairly safe. Now, for most people who have a period, that their cycle is every 28 to 30 days, usually they ovulate around day 14 or 15. And so we count your fertile days as starting around day 11. And we count you as being fertile until about day 19 of your cycle. So it's about 11 days where you are uncertain of whether or not you may or may not get pregnant. Now, you can have sex during this time if you want to obtain a pregnancy. But if you do not, either abstain or use a condom or a diaphragm. Or if you want to use the morning after pill, that is always an option, and our midwives can talk to you about that. And then after about 5 or 6 days after you've had what we presume to be ovulation, you generally are safe, and then you can have intercourse, protected or otherwise, during the next few days until you have your next period. If you're trying to get pregnant, this green time on the calendar is a good time to try. Now, does that mean that you have intercourse 5 times a day? Nope, because guess what? Sperm have to grow up and get mature. I actually recommend every 48 hours if you are trying to attempt pregnancy. Not every day, not multiple times a day, every 48 hours so that those sperm mature. In addition to the calendar method and to paying attention to your cervical mucus, you can also take your temperature. Generally, people will have a spike in their temperature on the day that they ovulate. Now let's look at this. This basal body temperature chart. So basal body temperature is your temperature that when your body is at complete rest, what it is. Now, what does complete rest mean? So, to take your temperature, you need to actually wake up earlier than when you normally get up, probably between 4 and 5 in the morning. Doesn't mean you get out of bed, doesn't mean you do jumping jacks. You open your eyes, you grab a thermometer, you stick it in your mouth, and you take your temperature. Then, if you need to use the bathroom and get up, you can, but you take your temperature before you move. You need your temperature at rest. And then you would chart that temperature every day. Now, you can see that there's little fluctuations. However, around day 14, 15, there's a big spike in the temperature. And then after that, it might hover around up here. It might go back down to this more normal temperature, but usually on the day of, you have a big spike. Again, if you are checking your cervical mucus, this particular chart has a lot of different type of letters that it used to mark the type of mucus that you might notice, but S means slippery, and that coincides with the spike in temperature. And this is a method that you can use to prevent pregnancy. It is also a method that you can use to help obtain pregnancy by having intercourse around this time period.